Hello, my name is Lindsay. Thank you for joining me for this presentation. Today we will be discussing diabetic retinopathy for Nursing 440, which is Community Health Nursing for Indiana State University Bachelor of Science Nursing Program. Alright, I am going to have you pause here for a moment, and there is a link with a pretest in the video comments. If you could take this test to determine your knowledge of diabetic retinopathy before the presentation, that would be appreciated. So what is diabetic retinopathy? Diabetic retinopathy is a condition that causes changes in the blood vessels of the retina, so in the eye. There are two stages of diabetic retinopathy, non-proliferative and proliferative retinopathy. Non-proliferative is the early stage of the disease, and in this stage, the blood vessels in the eye swell, or in the retina, swell and leak, which can cause macular edema, which is swelling of the retina, and may cause mild vision loss. Proliferative retinopathy is the advanced stage of the disease, and in this stage there is new and abnormal blood vessels that develop on the surface of the retina. These blood vessels can then break and bleed into the vitreous. That's the clear gel-like fluid inside your eye, and this can cause severe vision loss. Okay, so those at risk are obviously going to be diabetics. Along with diabetes, the increased risk is a long-standing diabetes, so the longer you've had them. If you have poor control over your blood sugar, if you have hypertension or hyperlipidemia along with your diabetes, pregnancy, tobacco use, and being of African American, Hispanic, or Native American descent will also increase your risk of developing diabetic retinopathy if you are a diabetic. So signs and symptoms are going to be spots or dark strings floating in your vision. Usually these are referred to as floaters. Developing blurred vision, fluctuating vision, if you're seeing dark or empty areas in your vision, or you are having any sort of vision loss. Alright, now for diagnosis, there are multiple tests that can be done, all vision tests. Firstly, all diabetics should be having their vision tested at least once a year to check for diabetic retinopathy. Now we're going to do a visual acuity test, and that's going to be your basic common chart measuring that you think of when you think of a vision test. And that measures the central vision at different distances. Tonometry, this is going to be a test that checks the pressure within the eye. Pupil dilation, this is where they take the drops and they dilate your pupil, which means to widen it, and this is for a close-up look of the provider to look at your lens and your retina. And then there's ophthalmoscopy. That is going to be an up-close exam of the retina with a specialized magnifying glass. Fluorescein angiography is an organic dye that's injected into the bloodstream, and that's going to show the path of blood of the eye, and pictures are taken at the same time to see if there's any leaking of those blood vessels or if they are no longer supplying the retina. And then optical coherence tomography is light waves that are used to make detailed images of the eye. Alright, so there are treatment options for diabetic retinopathy. First is going to be laser surgery. Laser surgery is often used to treat proliferative retinopathy, so the more advanced stage, and sometimes the macular edema that's caused by the non-proliferative retinopathy. This procedure involves shrinking the abnormal blood vessels or sealing the ones that are leaking. Vitrectomy is a procedure that involves taking the jelly-like substance, so the vitreous, the clear fluid that fills the center of your eye. It's then replaced with a balanced saline solution. And then there are injections. They use certain medications to inject into the eye to slow the growth of the abnormal vessels of the retina, and then they also use those injections to treat the macular edema. All right, so the number one way to try and prevent the development of diabetic retinopathy is going to be to manage your diabetes. Take your medications as you're directed to. This includes insulin if needed. Eat healthy and balanced diet. This will help manage your blood sugar level. Exercise, also used to help lower your blood sugar. Test your blood sugar regularly, both daily random and A1C, which gives an average over 3 months. Test urine for ketones, and have regular healthcare follow-ups to evaluate your diabetes control. And as mentioned before, making sure you get that yearly eye exam to check to make sure if there is any start or progression to diabetic retinopathy. Alright, so we've reached the end of the presentation here. I hope you have learned something new that may help you or a family or friend in the future. I will have you repeat the test taken at the beginning of this to see what kind of knowledge that you have obtained. For resources, if you would like more information on diabetic retinopathy, you can always visit the American Optometric Association at AOA.org, or the American Academy of Ophthalmology, which is AAO.org, or you can reach out to your primary care provider. Thank you for joining me. Hope you enjoyed.